Hello friends, today I'm going to tell you about menstrual. In this video we will cover: what are the 4 stages of menstrual cycle in order? What is the menstrual cycle? Phases of the menstrual cycle. Common menstrual problems. When to see your doctor. Homeopathic treatment. So let's get started. What are the 4 stages of menstrual cycle in order? The menstrual cycle has 4 phases: menstruation, the follicular phase, ovulation, and the luteal phase. What is the menstrual cycle? The menstrual cycle prepares your body for pregnancy. If you are not pregnant, your hormones send a signal to your uterus to shed its lining. This becomes your period. Once you start your period, the cycle starts again. A menstrual cycle is measured from the first day of your period to the first day of your next period. The average length of a menstrual cycle is 28 to 29 days, but every woman's cycle is different. For example, teenagers might have cycles that last 45 days, whereas women in their 20s to 30s might have cycles that last 21 to 38 days. Your first period is called menarche. In Western countries, the average age for a first period is 12 to 13, but it can start as early as 9 and as late as 16. Your last period is called menopause. In Australia, the average age for women to reach menopause is 51 to 52. Some women might reach menopause as late as 60. Phases of the menstrual cycle. There are 4 main phases of the menstrual cycle. 1. Menstruation. Menstruation is commonly known as a period. When you menstruate, your uterus lining sheds and flows out of your vagina. Your period contains blood, mucus, and some cells from the lining of your uterus. The average length of a period is 3 to 7 days. Sanitary pads, tampons, period underwear, or menstrual cups can be used to absorb your period. Pads and tampons need to be changed regularly, preferably every 3 to 4 hours, and menstrual cups should be changed every 8 to 12 hours. 2. The follicular phase. The follicular phase starts on the first day of your period and lasts for 13 to 14 days, ending in ovulation. The pituitary gland in the brain releases a hormone to stimulate the production of follicles on the surface of an ovary. Usually, only one follicle will mature into an egg. This can happen from day 10 of your cycle. 3. Ovulation. Ovulation is when a mature egg is released from an ovary and moves along a fallopian tube towards your uterus. This usually happens once each month, about 2 weeks before your next period. Ovulation can last from 16 to 32 hours. It is possible to get pregnant in the 5 days before ovulation and on the day of ovulation, but it's more likely in the 3 days leading up to and including ovulation. Once the egg is released, it will survive up to 24 hours. If sperm reaches the egg during this time, you may get pregnant. 4. The luteal phase. After ovulation, cells in the ovary, the corpus luteum, release progesterone and a small amount of estrogen. This causes the lining of the uterus to thicken in preparation for pregnancy. If a fertilized egg implants in the lining of the uterus, the corpus luteum continues to produce progesterone, which maintains the thickened lining of the uterus. Common menstrual problems. Some of the more common menstrual problems include premenstrual syndrome, PMS. Hormonal events before a period can trigger a range of side effects in women at risk, including fluid retention, headaches, fatigue, and irritability. Treatment options include exercise and dietary changes. Dysmenorrhea, or painful periods. It is thought that the uterus is prompted by certain hormones to squeeze harder than necessary to dislodge its lining. Treatment options include pain-relieving medication and the oral contraceptive pill. Heavy menstrual bleeding, previously known as menorrhagia, if left untreated, this can cause anemia. Treatment options include oral contraceptives and a hormonal intrauterine device, IUD, to regulate the flow. Amenorrhea, or absence of menstrual periods. This is considered abnormal, except during prepuberty, pregnancy, lactation and postmenopause. Possible causes include low or high body weight and excessive exercise. When to see your doctor. Talk to your doctor if you are worried about your period. For example, if your period patterns change, your periods are getting heavier, i.e. you need to change your pad or tampon more often than every 2 hours, your periods last more than 8 days. Your periods come less than 21 days apart. Your periods come more than 2 to 3 months apart. Your symptoms are so painful they affect your daily activities. You bleed between periods. You bleed after sexual intercourse. Homeopathic treatment for irregular menstruation is very competent, non-invasive, safe and inexpensive. Homeopathy treats the patient as a whole and looks deeper into the problem, promotes the immune function and maintains uterine health by eliminating the causative factor. Following remedies are highly recommended for menstruation: belladonna, chamomilla, simicifuga, also called Actaea racemose, cocculus, magnesia phosphorica, bovista, Calophyllum thalictroides, colocynthis. Thanks for watching. Doctor Online 24/7 by Dr. Sana Bawani.